This is Radio Health Journal. I'm Reed Pence. This week, the complicated reasons parents don't get their kids vaccinated.
He just came off as condescending, and I marched out of his office with my heels more dug in about not vaccinating.
What gets in the way of vaccination facts when Radio Health Journal returns.
I'm Nancy Benson, host of Radio Health Journal. If you enjoy Radio Health Journal, you'll also like our sister show. Here's a preview of what they're covering on Viewpoints this week.
This week on Viewpoints.
Between 1919 and 1932, the top 5 grocers in the country were receiving from 4% of America's grocery dollars all the way up to 30% in just 12 years.
Co-ops in a crowded grocery landscape. Then,
for a moment, you're part of the recording of history.
The timely art of illustration. I'm Marty Peterson.
And I'm Gary Price. These stories in depth this week on your public affairs magazine, Viewpoints.
Listen to Viewpoints on your favorite radio station, iTunes and Stitcher.
One of the triumphs of modern medicine has been the rollback of vaccine-preventable diseases. But it doesn't take that much to puncture our defenses, especially when it comes to a highly contagious disease like measles. Measles was declared eliminated in the United States back in 2000, but you'd never know it now. This year, the CDC says there have been around 900 cases of this potentially deadly disease in the United States. There have been outbreaks in Canada as well. The problem is that not everyone has been immunized who should be. And in this segment, we'll talk about the complex reasons they're not and what could change their minds.
We'd like to see our immunization rates up around 90% or higher. It's quite a bit lower than what we would like to see for pretty much all of our vaccines.
That's Dr. Julie Bettinger, Associate Professor of Pediatrics at the Vaccine Evaluation Center of the University of British Columbia.
Measles, for example, we actually need it to be higher than 90%. So it needs to be 93 to 95% of the population vaccinated in order to interrupt transmission. It's an incredibly infectious organism, and we need higher levels to stop transmission of that organism. Something like mumps, it can be slightly lower, maybe 88%, so not quite the 90% threshold. But if we target sort of 90%, that'll get us where we need to be for most of our diseases. And I think it's a bit easier for people to sort of think about and an easier target to reach.
High rates of immunization are important to protect both the person being vaccinated and those around them who can't be.
If we get enough people in our community vaccinated, we also generate community-level protection, or herd immunity is what this term is also called. And the way this happens is that by vaccinating a large enough percentage of our population, we can actually stop the transmission of infectious diseases. And in that way, we're able to protect people in our population who, as you said, can't be vaccinated. So these would be people with cancer, people with immunosuppressive disorders. There's a whole range of conditions that would make someone unable to be vaccinated, or oftentimes they can be vaccinated, but the vaccines don't work as well in them as they do in someone who's healthy. So that would be sort of our older people in our population, so grandparents. As you age, your immune system starts not functioning as well, and so we really want to be able to protect older people who will be vaccinated, but they just may not be as well protected from the vaccine.
Infants under 2 months old can't be immunized either, so doctors try to make sure everyone around them will be, a strategy called cocooning. Vaccines can clearly prevent both contracting and spreading deadly diseases. But despite that, and even though vaccines have saved millions of lives, some parents are dead set against letting their children be immunized. Many more have serious reservations.
Somewhere between 40 and 70% of Americans, so a majority of Americans, have some concerns about vaccines. Right, and that includes a lot of people who vaccinate, but there's some degree of vaccine hesitancy.
Dr. Mark Navin, Associate Professor of Philosophy at Oakland University, has studied what makes people vaccinate and what leads them to avoid it.
Across that sort of continuum, there's a lot of low-hanging fruit. There's a lot of people who are refusing only 1 or 2 vaccines. Now, there are a lot of kids who have 1 dose of MMR and not 2. There are a lot of people who are vaccinators but are either delaying or following an alternative schedule. And these are people who, I think the evidence shows, are much more able to be persuaded or nudged towards vaccination.
Much of the time, a talk with a family doctor is what nudges parents toward vaccination. But Navin says the conversation usually isn't about how a parent's actions will help every other kid. Parents are motivated by care for their own child. They want an assurance that vaccination will protect their child and that it's safe.
Certainly, I do a lot of research with parents who have either started immunizing and stopped or didn't start immunizing and changed their minds and started immunizing. And it's a very interesting group to talk about because, as you point out, one of the main reasons that they will start immunizing is a very strong recommendation from a healthcare provider that they trust. So I think, and across studies we see this, sort of the number one reason that people will immunize is that a healthcare provider they have trust in strongly recommends it to them. I think depending on the person rolling their eyes and saying your concerns are silly and dismissing it is probably not going to be helpful. I think the most important thing is to kind of listen to the person in front of you and hear what their concerns are and then address their concerns. But that really takes a trusting relationship between you and the person in front of you.
Kristen O'Meara could have used that kind of talk. She's a teacher in the Chicago area who's now had her 3 daughters vaccinated. But she admits that in the beginning, she was looking for reasons not to vaccinate.
There were enough examples of kind of pharmaceutical mess-ups or mistakes that I kind of felt like, well, our children are guinea pigs. And I just did not trust that we could believe what the pharmaceutical companies were saying about their products.
Amira had also found plenty of websites seeming to confirm her belief that vaccines weren't safe. Bettinger says she understands why parents with doubts may be swayed by anti-vaxxing sites online.
I think they prey on fear, and they do it very successfully, and that's not necessarily a tact that I think public health or science should take. I don't think it's an honorable way to approach things, but it's a very effective way. And I think what I find also quite interesting is often there'll be a slight kernel of truth in what they put out there. You know, it is based very slightly in science, but then it gets warped a bit. So you really have to, again, that's why it's important to sort of sit down with a person in front of you and understand what they're reading, what they're seeing, what's concerning them, and then address it. Because if you understand the specific concerns they have, you can then say, well, yes, this piece of it's true, but here's what really happens with it. And without having that understanding, then it's quite difficult to combat, and it's difficult to do that without a conversation.
But that's not what happened with O'Meara when she went to her new family doctor.
He was pretty condescending about my decision, and I can understand why. Now that I'm on the other side of the issue, I can understand why. He's probably thinking to himself, oh, here comes another one of these fools that I have to talk to about the importance of vaccinating. But to me, he just came off as, like I said, condescending and just not taking my concerns seriously. And I just sort of marched out of his office with my heels more dug in about not vaccinating.
That happens because, to doctors and to public health experts, the benefit and safety of vaccination is an open and shut case. Navin says doctors are the outlier when it comes to risk assessment. If it were up to them, none of us may ever put a swimming pool in the backyard. But when parents refuse to vaccinate their kids, doctors often feel like facts don't matter.
The facts do matter, but they're not the only piece of information that gets considered when parents are deciding whether or not to vaccinate their kids. The facts are just one piece of the story.
That's Avnika Amin of the Rollins School of Public Health at Emory University. She's co-author of a study in the journal Nature, which finds that the moral values we hold, the way we judge right and wrong, have a lot to do with our decisions on vaccination, just as they shape everything else we think, say, and do.
We're human beings. We don't make decisions in a void just based on the facts. There's a lot of different factors involved, things like emotions, which are you worried that your kid is going to get sick? Are you worried that maybe your kid is going to have some sort of reaction to the vaccine? So there's that kind of emotional fear-based aspect. There's also sort of the way we value different things when it comes to the decisions that we make.
Facts and values, or the judgments we make about facts and values, are not separate. And in fact, we often make sort of science-informed or fact-informed decisions motivated by our prior value commitments. And so the literature shows pretty clearly that a lot of people who are refusing vaccines, they're not rejecting science in any explicit way, but they're skeptical of capitalism, right, which lots of people have good reason to be skeptical about. This is where the big pharma critique comes in. And they're skeptical about abuses of government power, and that these sort of value commitments can lead them astray when it comes to factual judgments about safety and efficacy of vaccines.
That's why, in a Mean study, people who are leery of vaccines score lower in how they value respect for authority. They're less likely to accept that something is true just because doctors or the government say so. To them, what family and friends say is a lot more important. Amin says anti-vaccine parents are also likely to score high in their valuation of purity and liberty.
This could possibly relate to issues of perceived toxins or artificial chemicals that are being used in vaccines compared to what might be thought of as a more natural process of disease. For the Liberty Foundation, again, people who were more hesitant tended to have a higher score for the Liberty Foundation. So this could maybe relate to issues of personal freedoms in deciding whether or not to vaccinate your child. You don't really want anybody else telling you what to do. You want to decide for yourself. And that can also kind of tie in a little bit with the resistance towards government mandate around vaccination.
How the facts are presented and by whom is also important.
If you knew someone took a position that was very different from your own personal position and they started throwing out just facts at you, we're not as inclined to listen to people when we think that there's a lot of differences between what we value versus what they value.
Our minds get changed by people with whom we're in relationship and who already share most of our values. So rather than have, and this is maybe a media criticism, rather than people in the media having physicians on TV to lecture people about vaccinating, let's have better public health outreach that involves the media that connects members of communities with low vaccination status or where there are ongoing outbreaks with a sort of advocacy message to reach these populations.
For Kristen O'Meara, it was an unfortunate experience that changed her mind and got her to vaccinate her kids. Before then, she says she'd engaged in magical thinking. She figured, well, no one gets these diseases anymore, so it doesn't matter if they weren't immunized. Then they all got sick with rotavirus, which around the world kills more than 200,000 children per year.
Definitely, it was a wake-up call. I mean, it was something, well, looking back on it now, it's like, well, duh, of course. Why are you surprised? You and your whole family got sick with something that could have been prevented with a vaccine.
Now she's on the other side, a former anti-vaxxer, now a vaccine advocate, and she understands why parents may be worried, even if the myths about autism and other safety hazards have been disproven. It's not just the facts, it's who we learn them from and how.
This issue really calls for some empathy and some understanding that I'm just a human being and I see now that I made a mistake, and thankfully my children are fine and there's no irreversible damage from my mistake. But I'm just a human being and people on the other side of the fence are just human beings. And I think it's time in this debate, all debates, but this debate in particular, that we honor the humanity of other people and listen to them and help them feel listened to. And for parents who are kind of on the fence or they've heard some scary things about vaccines, they have questions, they want to know, I think we need to take those concerns seriously and honor the question and honor the questioner and say, yeah, it's understandable that you might be fearful.
You can find out more about all of our guests on our website, radiohealthjournal.net. You'll find podcasts of our segment there, as well as on Apple Podcasts, Google Play, and Spotify. Also, check us out on Instagram at Radio Health Journal. I'm Reed Pence.
June is Alzheimer's and Brain Awareness Month, and the Alzheimer's Association is joining forces with the Ad Council in a new campaign, encouraging families to talk about memory loss and other potential warning signs of Alzheimer's disease. Ruth Drew, Director of Information and Support Services for the Alzheimer's Association.
Close family members are typically the first to notice memory issues or cognitive problems, but they are often hesitant to say something, even when they know something is wrong. This new campaign is aimed at empowering families to have these conversations before a crisis occurs.
Titled Our Stories, the new campaign targets family members and features real stories, encouraging people to notice the signs, trust their gut, and start a conversation. It's an essential first step on the path toward managing disease-related changes. Families can start with ABC, assess changes, begin a conversation, and contact the Alzheimer's Association for help at alz.org/ourstories.
How much do you know about migraine? June is National Migraine and Headache Awareness Month, so it's a great time to start learning. You probably know that migraine can be disabling and marked by severe head pain. But did you know that migraine is the third most prevalent illness in the world? In the U.S. alone, millions of people are affected by migraine. And did you know that 1 in 3 patients with migraine avoid planning activities because they fear a migraine attack will force them to cancel? Are you losing precious moments to migraine? What if you could find more moments with less migraine? Ajovy Fremanizumab VFRM injection is a prescription medicine for the preventive treatment of migraine in adults that reduces monthly migraine days, and for some, cuts their migraine days by 50% or more. Ajovy is the only preventive treatment for migraine that can be taken quarterly as 3 225 milligram injections or monthly as 1 225 milligram injection. Do not use if you are allergic to Ajovy or its ingredients. Ajovy may cause allergic reactions such as itching, rash, hives, swelling of face, mouth, tongue, or throat, or trouble breathing hours to 1 month after use. Get medical help right away if you have swelling or trouble breathing. Common side effects of Ajovy include injection site reactions. For more information about Ajovy, including the full prescribing information, talk to your doctor. Call 800-887-8100 or visit ajovy.com.
Thank you for listening to Radio Health Journal, a production of MediaTrax Communications. If you enjoyed this broadcast, please support our show by subscribing, sharing it with a friend, and leaving a review on Apple Podcasts. You can find more Radio Health Journal stories about health, science, and technology on Apple Podcasts, Google Play, Spotify, and RadioHealthJournal.net. Also, follow us on Instagram and Twitter at Radio Health Journal.